We've all been there, right? That deep, throbbing ache in your jaw that just makes everything miserable. You can't eat, you can't sleep, and your mind goes to one place, to the one dental procedure we've all learned to dread.
I mean, when you think of the absolute peak of dental fear, what's the first thing that pops into your head? For pretty much everyone, the answer is instantaneous.
Yep, the root canal. For decades, it's been the heavyweight champion, the standard treatment for a tooth nerve that's seriously angry, what dentists call irreversible pulpitis.
But here's the plot twist, the idea that's really starting to shake things up in dentistry. What if that procedure, the one we all just assume is the only option, is actually overkill a lot of the time? What if there's a better, smarter way?
Okay, so let's get on the same page. A traditional root canal, or RCT, is basically an eviction notice for everything living inside your tooth. The whole pulp, the nerve, the blood vessels, all of it gets taken out, then the canals are cleaned and sealed up.
Now look, root canals absolutely save teeth from being pulled, which is great, but they've got some serious downsides. They can be expensive, they take a while, and by hollowing out the tooth, they actually weaken it, making it more brittle. So you save the shell of the tooth, but you lose the living heart that keeps it strong.
All right, this sentence right here, this is the key that unlocks this whole new way of thinking. For years, the logic was super simple. If you have severe pain, the nerve is dying, and it's a goner. But when scientists actually started looking under the microscope at these doomed teeth, they found something that changed everything.
And here's what they found, in plain English, that terrible pain is usually just a small, localized fire. It's often just in the top part of the pulp, right under the cavity. The rest of the tissue, deeper in the roots, it's often perfectly healthy, just waiting for a chance to heal. The fire's in one room, you don't have to demolish the whole house.
And this realization opens the door to a completely different approach, vital pulp therapy, or VPT. Instead of a total clean-out, VPT is more like a surgical strike. The whole goal is to just carefully remove the sick, inflamed tissue and leave all the healthy stuff behind to heal and keep the tooth alive.
The difference in goals here is just massive. Think about it like this. A root canal is like cutting down a whole tree because one branch looks sick. Vital pulp therapy is like being a good gardener and just pruning that one sick branch so the rest of the tree can keep on growing. It's total removal versus targeted preservation. So why do we care so much about saving the pulp? Well, the benefits are huge. The procedure's often simpler and cheaper, the tooth keeps its natural strength, it even keeps its own little immune system, and its ability to feel pressure, which is super important to keep you from biting down too hard. Oh, and yeah, studies show it often means less pain after the procedure.
So, the million-dollar question, does this actually work? The answer is pretty incredible. When it's done right, with the right materials, studies have shown success rates as high as 96%. This is not some fringe experimental idea. This is a seriously effective treatment.
But, and this is a really big but, the materials matter a lot. The success of VPT really depends on what the dentist uses to cover that healthy pulp. These modern materials, these hydraulic calcium silicate cements, have incredibly high and consistent success rates. The older stuff, not so much. The technology here has been a total game changer.
You know what's also really interesting? The research tells us what's crucial for success, like how healthy the pulp was to begin with and getting a really good sealed filling on top. But what's fascinating is what doesn't seem to matter: your age, your gender, even which tooth it is. This approach is robust and works for almost everybody.
Okay, I know what you're thinking. If this is so amazing, why is my dentist still talking about a root canal? Why isn't this the standard of care everywhere? And you know what? That is exactly the right question to be asking, because there are some real-world hurdles.
For starters, it's not a magic bullet. It doesn't work 100% of the time. There's always a chance the pulp won't heal and you'll end up needing that root canal down the line anyway. It really requires a dentist with great technique who knows how to pick the right cases.
And beyond that, there are some practical problems. For one, those really good modern materials can be pretty pricey. It's also a delicate procedure that's tough to do in a rush during an emergency visit. But maybe the biggest thing is a training gap. A lot of dentists just weren't taught how to do this in school, so they stick with the root canals they know and trust.
But let's be crystal clear here. Even with those challenges, the science is in. The verdict is that for a massive number of people with a bad toothache, vital pulp therapy is a fantastic, conservative, and way more patient-friendly option. We are literally watching a paradigm shift in real time.
So how do we get there? How do we make this the new normal? Well, the road forward means creating clear guidelines, making the best materials more affordable, and for sure, updating the training in dental schools. But you know what might be the most powerful step of all? Educating patients. Educating you so you know to ask about it. And that's really what this all boils down to. Knowledge really is power. Just knowing that irreversible doesn't always mean what you think it means. Knowing that you might be able to save the living part of your tooth.
All right, so here's the bottom line. First, vital pulp therapy is a legitimate option, and it can save you from a more invasive and more expensive treatment. Second, its success really depends on getting the diagnosis right from the start. But third, and this is probably the most reassuring part, even if it doesn't work out, it doesn't automatically mean you lose the tooth. A standard root canal is still there as a fantastic backup plan.
Ultimately, knowing this stuff is power. The next time you or someone you know is facing a tough dental diagnosis, you're now armed with information about other options. So the final question is really for you. Knowing that these less invasive treatments exist, could simply starting a conversation with your dentist be the one thing that saves your tooth?